Hello everyone, I am Dr. Parag Telang and it gives me a great pleasure to welcome you all to this Instagram live session today. Now for this session we have with us today a very glamorous lady, Dr. Aditi Govitrikar. She is the only Indian supermodel actor with a medical and psychologist qualification. Dr. Aditi Govitrikar, in a true sense, is beauty with brains, a title given to her by Business Today and other leading publications. She has won accolades such as the Gladrag Supermodel and also the Mrs. World title. She is still the only Indian to have won the Mrs. World title. Dr. Aditi has acted in multiple Bollywood and Telugu films and she has made her mark in some iconic music videos and commercials over the years. Delving into health and wellness, Dr. Aditi currently also practices as a certified psychologist, counselor and mentors corporates with transformational workshops to help all lead a meaningful and fulfilling life. She is currently pursuing her second master's in psychology from Harvard University. So I will just Dr. Aditi to join us and then we can begin today's session. This session will focus. Hi Dr. Aditi.
Hi Dr. Parag, how are you?
All good. It's nice to have you with us
Pleasure's
live.
all mine. Thank you for having me.
Thank you for taking out the time for this discussion.
Yeah, thank you. Pleasure's all mine. I have so many questions for you, Dr. Parag, and I know that you've been doing some wonderful work. So whenever you're ready, I have these questions ready for you.
I think in the last session that we had on your Instagram page, there were a lot of queries about body contouring and the lot of options that are available, and we could not answer many queries that our viewers had. True. So I think let's focus again on mommy makeovers and body contouring options today.
Absolutely. So that was my question. That what do you mean by mommy makeover? What all is there in it? So just tell us all about it.
So mommy makeovers are basically surgeries which are designed to recreate the shape that a woman has before pregnancy. Now what happens is during pregnancy there are so many changes that happen in the body, be it in terms of the tummy area or be it in terms of other aspects such as the breast or gaining of weight. Now, a woman does not have too much control over all these changes that happen in her body. She is busy with her child and with the pregnancy itself. So what happens is we see a lot of women who post-pregnancy, they end up with a lot of flab in the body or a lot of weight gain. And this flab, they are somehow never able to lose post their delivery by just dieting or exercise. Now, the reason for this is that when we go on very strict dieting, the fat cells just shrink in size. They actually remain in the same place. So if there is again a gap between the diet habit or in the exercise, we always have the especially in the tummy area, there are a lot of elasticity changes that happen. So there is something like a stretch mark that can be seen, or the skin may lose its tone. Because it's a problem of elasticity, no matter how much one does gymming or core exercises, we are still not able to achieve a very flat tummy just by exercising because the skin has lost its elasticity. So there are procedures such as a tummy tuck, which is designed to make the tummy flat and get rid of the stretch marks. There are procedures for breast firming. There are procedures for adding volume to the breast. So all these surgeries, they are bracketed under an umbrella term called as a mommy makeover.
Right. And do you see a lot of older women coming to you for body contouring, for cosmetic procedures? So if you take a ratio of, say young women, say from 18 to 40 and 40 plus, what is your observation in your practice been?
Yes, there is a lot of awareness amongst people of all age groups about the need to look fit, or the need to look better, especially in this era where we are all working online, or most of the professions have shifted to a work from home kind of mode where people have to be online. I feel
Yeah.
the need to look that much presentable is even more. So we do get a lot of women in their 40s, in their 50s, who have completed their family and who are now looking for options to tone themselves, or to get a leaner body or to become fitter. Yeah,
Okay, so there is quite a lot of traffic coming your way where cosmetic
there is.
procedures are concerned. And what about men? Do you see a lot of men? Do you see a lot of older men? And if older men are coming to you, what is it for? Of course, we know that, hair loss is a big issue, but are there any other procedures that they come to you for?
Yeah, there are plenty of procedures for which men come to us. Simple things like having wrinkles on the face, or somebody having lost a lot of weight with sagging of the cheeks or hollowing of the face. Simple things like a double chin, because people are nowadays clicking selfies all the time, and
Yeah.
if you have even the slightest amount of double chin, it's immediately visible on the selfies. So
Yeah.
yes, people are quite aware, and you'll be surprised that yes, people, not only for hair, for other areas of the face also, a lot of men inquire about a lot of cosmetic procedures.
Right. And what about facelift? The worry about facelift in most people's mind is that it's going to leave some kind of scar, it's going to be visible, everybody's going to know about it. So first, I wanted to explain the facelift, the surgical and as well as the non-surgical, because I know that you do specialize in a lot of non-surgical facelifts as well.
Yeah.
And do those leave any marks or telling signs to people who've undergone that?
See, the whole concept of a facelift is based on the fact that we are able to tighten and tone up the layers of the face. Now, as you mentioned, there are a lot of non-invasive or non-surgical options for face tightening, be it botulinum toxin, or be it hyaluronic acid fillers, or be it threads, which we can use in the younger age group up to the age of 30 or 40. But after the age of, I would say, 50, there is a lot of sagging in the face, or there is a lot of loose skin. Now, unless we address this loose skin or remove this loose skin, it is not possible to obtain a face which looks younger or which looks tighter. So, the concept of facelift is to tighten not only the skin but also the underlying tissues, which are called as the smash layer. So, to tighten the smash layer, the incision is quite concealed. It starts somewhere at the level of the eyebrow, but it's inside the hairline. Then it curves in the crease in front of the ear root, and then it goes inside the skin here.
Right.
So it's like a 2-inch incision, which over a period of you can say a month or a month and a half becomes almost invisible. So
Right.
even men who keep their hair short, it's not incision which is visible after a few months.
Okay, and you want to explain a bit about, you mentioned Botox, hyaluronic acid, as well as fillers, which is hyaluronic acid, of course, and threads. So
Yeah.
you want to explain each one of them a little bit in detail so people know what is the difference, what would be ideal for which group, and so on
Sure.
and so forth.
Sure, that's a very good question actually. See, when we start to age in our 30s, what we basically have early on are what are called as dynamic lines or dynamic wrinkles. Now, dynamic wrinkles are what are seen only with action. Like when I'm raising my eyebrows, you will see some lines on the forehead, or when I do this, there are creases around the eyes. So these lines happen because the muscles, they contract in such a way that the skin on top of the muscle, it bunches and it creates these lines. So for somebody who has these kind of dynamic lines, the best option is to go for a botulinum toxin. What this toxin injection does is it neutralizes the strong action of the muscle, so that those lines don't form when we talk or when we animate. Now there
But
are
is it
certain.
safe? Because that's a worry that a lot of people have, that when you take Botox, it's like you said, it's a toxin, right? So is that then safe? We do know a lot of people have been using it for a long time, but even then, I just wanted to ask this question to you:
It
how
is
safe is it?
absolutely 100% safe treatment because the botulinum toxin which is used is an attenuated toxin. It does not cause any systemic side effects or doesn't have any harmful effects on the body. It works only in the muscle in which it is injected.
Hmm.
Now, there is a particular number of dosage in terms of the units of botulinum toxin which has been described for each single muscle on our face. So just make sure that your injector knows and has been doing botulinum toxins regularly, and it's one of the safest treatments ever.
And how long does the effect last for?
The effect of the toxin will last for around 6 months, and
Hmm.
after 6 months, if somebody decides not to go for the treatment again, it does not mean your wrinkles will increase. You will just come back to what the face was before the botulinum toxin.
So why is the fear that oh, like you have a Botox look, so your face is frozen and you will not have like any movements on the face? Why
Yeah.
is that fear there in people's mind?
I get this question. I get asked this question all the time. So what happens is, if the recommended dosage for the forehead and for the crow's feet and other areas is 25 to 30 units, some injectors they tend to do it like 50 units or 100 units, which is more than what is the recommended dose. Now, if you inject the entire musculature of the forehead with a lot of Botox, it is going to paralyze all the muscles, and then you will not be able to have any expression, and that's what is called as the frozen face.
Yeah,
So
yeah.
in order that one does not get this kind of a frozen appearance, it's important to be subtle on it. No,
Hmm.
never overdo a treatment. Do it in a proper way, in a systematic way, and with an injector who knows how to inject in which areas. It has to be a customized plan for each patient. It
Right.
cannot be a one shoe fits all or one box kind of a model.
Absolutely. So the experience of the injector counts to a very big extent where
For
Botox is
sure.
concerned, I would say. Now, along with aging, after a certain age, the issue of drooping eyelids also comes into play. What is the treatment for that? Is it a common problem? And obviously, it's rather a common sense that you can't use Botox for that, right? For that muscle. So what is the
Yeah.
treatment? How do you prevent it? Is there any preventive care that people can take to avoid it in a long run?
Let me go back reverse way in terms of answering your question. There is nothing that we can do to avoid the skin becoming loose or the eyelids becoming loose. There is nothing much that we can do as a preventive step. But once the
Hmm.
eyelid skin starts to be droopy, initially there are non-surgical options such as giving a bit of botulinum toxin to lift up the eyebrows, or doing a bit of
Hmm.
threads to lift up the eyebrows, which can tackle the early signs of aging. Now, as the 45s or 55, 60 kind of age happens, there is going to be a lot of loose skin which will be seen on the upper eyelid and also the lower eyelid. So when
Hmm.
there is bagginess or puffiness in the under eye area, or where there is a lot of loose skin, then is the time to go for a procedure called as a blepharoplasty.
Hmm.
Now, this is an extremely safe procedure to remove the skin of the upper and lower eyelid. The incision is concealed in the crease on the upper eyelid, so it's never visible. The crease in the lower eyelid is very close to the eyelash, so again that part of the incision is never visible. And it is literally like a 45-minute procedure which can
Hmm.
completely rejuvenate the eyelid area.
Hmm.
Because whenever we meet somebody, the main attention that always catches our attention is the eyes. And plus, now with the mask being in place, eyes are the thing that you can see.
True. Absolutely. And it is
Yeah.
completely safe. There are no side effects. And how long does it last for?
It is completely safe, and it does not have anything to do with our vision, because we are dealing only with the skin and the fat bags. Of course, it does have a recovery time of, you can say, 8 days or 10 days, because the skin is very, very delicate in this area. So people post surgery will have some bruising, they will have some swelling, they may have to wear some dark glares when they go out for meetings or, for interacting with people. After this 8-10 day initial period of healing, the results start to be visible. And after 1 month, they look absolutely like 20 years younger. And the
Wow.
effect will last easily for 8 to 10 years.
Right, right. Now, going back to anti-aging procedures, we've been talking about those. A question which is a little bit of off the track, so to say. What are the 3 or 4 things that a person can do to completely, okay, not maybe 100%, but to slow down the aging of the face and neck area? What would
See,
your advice be?
see, as I said, our face is a combination of a bone, which is formed by the skull. Then there is a layer of muscles on top of that, and then there is a layer of skin and fat. So there is nothing we can do to the bone for sure. For the muscles, maybe you can do some facial exercises of the neck or of the eyelids or of the eyebrows, and you'll be able to delay the aging of the muscle layer. For the skin and the face and the skin and the fat layer, it's important to maintain the body weight. So
Right.
if somebody has a weight fluctuation of maybe a kilo, couple of kilos, is no problem. But if you gain like 8-10 kilos of weight and then you suddenly lose that amount of weight, then skin is like an elastic. The more you stretch it, the more it's going to become saggy and loose. So I
Yeah.
think maintaining a healthy diet and following a good exercise regime and keeping a track on the weight is very, very important.
Okay, now coming to facelifts again, the one facelift which has been in vogue is a liquid facelift. Tell us more about that.
Yeah, there are a lot of inquiries now about a liquid facelift that we do. So liquid facelift is basically a concept of putting volume back in the face. What happens is, if we compare our photos when we were 20 years old and then 30 and then 40, 50, we will see that we progressively keep losing fat from various aspects of the face. So the under eye area tends to become hollow, the cheeks start to go in, the middle cheek becomes sunken. So all this is because the fat compartments in these areas, they start to hollow out. So to volumize these areas of the face, the term that came into vogue was liquid facelift. Now in liquid facelift, what we do is we harvest a little bit of fat either from the tummy or from the inner aspect of the thigh with a tiny needle, and that fat is liquefied, it is purified, and then in the form of a liquid it's injected in specific areas of the face. So we get a lot of middle-aged people who don't want to go for a facelift, which is a more invasive procedure, or who are not having that kind of a skin laxity still. So in these people, you can say between the age of 35 to 50, they are very good candidates for a liquid facelift, where we can give a very good rejuvenation of the face just by simple injections of fat, maybe in the temples, in the under eyes, in the cheeks, or in the jawline. Now, this fat, because it's our own tissue, it does not have any harmful chemicals in it, or it does not cause any harmful effects or side effects. And plus, the advantage is that fat remains for many, many years. Our own fat also has a lot of stem cells. Now, these stem cells help in rejuvenating the skin. So this liquid facelift works in both the ways. We can volumize the face, get rid of the hollow areas, and plus the skin. If you have pigmentation or acne marks or any other issues of the skin, the stem cells which are present in the fat will completely remove all these blemishes, and you can really have a wonderful rejuvenation of the face.
All right, and how long does this last?
For many years. It remains at least for, you can say, 4 years, 5 years for sure. You just have
And
to
then does
maintain the
this, sorry, you have to maintain the,
just have to maintain the body weight. I mean, these are fat
ah,
cells, right? So if you
yeah.
lose a lot of fat after the fat injection procedure has been done, then even you can lose the effect of this fat.
Okay, okay. And so this is, one wouldn't call it a non-invasive procedure, right? This one. What are the non-invasive options for face tightening?
So for face tightening, the same liquid facelift can also be performed using HA fillers, hyaluronic acid fillers. Now these hyaluronic acid fillers, for specific areas of the face, there is a different type of filler. So for lifting the cheeks, for example, or giving a stronger chin or the jawline, there is a thicker filler which is used. And for thinner areas of our face like the under eye or for the lip enhancement, there is a different type of filler which is used. Now, though it's a minimally invasive procedure which does not require one to have any anesthesia or hospital kind of a stay, the effect is kind of temporary. It will remain for 10 months to 1 year, and post 1 year, you will need to get it done again.
So then would you recommend, do you think that then the liquid facelift is a better option than the filler option?
It's difficult. I mean, it varies from person to person. If somebody is, early signs of aging and needs only a little bit of volumization in certain areas of the face, then we can just do a HA filler in 10 minutes and you're back onto your job. If the volume that is required is more, then of course the cost goes on increasing per filler, because each syringe that we open, it's going to increase and add on to the cost.
Right.
So it depends. If somebody needs a lot of areas to be treated, fat works out to be a cheaper option, because it's not restricted by the amount of volume that we need. So we can do the complete face, and the cost will be lesser than with HA fillers.
All right, and let's come to the body now. What about fat loss? Because now, like you mentioned, it's a lot of people click selfies, and people have become a lot more conscious where body weight is concerned. So, what are the options then for fat loss? If, of course, one has gone on a diet and worked out and still not lost as much weight as they want. Right. So what are the options at your clinic for fat loss and body contouring, as you mentioned? What is body contouring?
See, basically body contouring means to get the body into shape. Now, all of us have certain areas in our body where we are not able to get rid of the fat from these areas. Some people have difficulty managing the waistline fat, some people have lower belly, some people have a tendency to deposit fat in the thighs. So the areas keep changing from person to person. It's little bit genetic, and you can't control that. Now what happens is the fat in the body is in a solid form, like how we have ghee or dalda. It is that kind of a consistency. So whenever we want to get rid of fat with a minimally invasive method, we first have to be able to liquefy this fat. So we now offer at our clinic, since the past, I would say 4.5, 5 years, we have a technology called as Vaser Lipo. So Vaser works on ultrasonic energy using very minimally invasive 2 millimeter or 3 millimeter probes. The fat in any area of the body can be liquefied, and this fat can then be suctioned out from that area. Now, as compared to the traditional method of liposuction, the amount of fat which can be removed by Vaser is 3 times more. So we can remove routinely up to 12 liters or 15 liters at one go. The skin tightening is that much better. And plus, remember, these are methods which don't need any sessions. Once you do an area, it's done for good. You just need one single session for each area of the body. So a lot of people are opting for this treatment at our clinic. We have done like more than 4,000 cases of Vaser lipo now, and it really gives phenomenal results. Once you are back in a good shape, then it's easier for you to do a bit of exercise or keep a watch on the diet, and it becomes easier for you to maintain it.
Right. And does it come back? Does the fat come back?
It doesn't come back all of a sudden. It doesn't come back for many years, because if an area has, say, 100 fat cells, with Vaser lipo we can definitely get rid of 80 to 85% of fat cells from that area. So the remaining number of cells, like 10%, 15%, they are not suddenly going to enlarge or increase in size. Just a bit of diet consciousness is all that the patients need to be able to maintain. It doesn't come back that easily.
Right. Now, coming to unmarried girls going for breast augmentation or any kind of breast surgery, is it safe? Because then does it hinder in lactation later on? because that's a question which a lot of girls have in their mind, right? That okay, we are not married, we've not completed our family, so to say. What do you have to say about that?
That's a very, very interesting question. It's a very important question for our viewers to understand that whenever we plan any breast surgery for an unmarried girl, there is a lot of concern that they have, or their parents or mothers especially have, in terms of whether my daughter will be able to breastfeed, or whether the breast functioning will get altered. So the answer to this is, for example, if we talk of breast augmentation using silicone implants, the silicone implants are placed in a plane which is behind the breast gland. So there is minimal interference with the breast tissues. Sometimes in unmarried girls, we place the silicone implants under the muscle, under the chest muscle. So there is absolutely no interference with the nipple sensation or with the future breastfeeding. Similarly, when we do procedures such as breast reduction, now sometimes what happens is when girls tend to gain weight, they don't gain only in the body, they gain in the breast as well, which makes them feel very conscious, and they are not comfortable with the size of the breast. So we use a technique which is called as a superomedial technique, and this technique can also give a very good shape of the breast, reduction in size, and with the safety and assurance that nothing will happen in future, and they can safely breastfeed their child in future.
And what about women who have completed lactation and sagging of breasts after lactation or after multiple pregnancies? A very common problem. What is the procedure for that? What do you recommend if they don't want to undergo, they don't want to use implants, for example? Then what is the option?
So the option which is now currently in vogue for enhancement of the breast is also something called as fat grafting to the breast. So if somebody has, for example, more fat in the tummy and the thighs, we can harvest this fat, purify it, convert it into what is called as a purified fat graft, and this fat can be injected in the breast area. Again, it's very safe because it's our own fat, so there are no chemicals or harmful things which are getting injected in the body. The only thing to remember between a fat cell grafting and a silicone implant is that fat grafting tends to remain for 3 years to 5 years, and the woman may need a touch-up procedure or a revisional procedure after 4 5 years to put more fat again, and silicone implants tend to be permanent. So but it's an option which is good and it's available.
Yeah, but what about lifts? Because for sagging breasts, and only fat will not help, right? Do you then have
Yeah.
to get rid of the extra skin, pull it up? How does that work?
So fat is mainly, as you correctly said, it's mainly for volume. Now,
Yeah.
if somebody has a very minimal kind of a breast sag, then we are now doing what are called as threads for the body contouring. So these are threads which are very effective for lifting the breast tissue. Of course, it is effective only for grade 1 or grade 2 kind of sagging. When somebody has more than a grade 2 or sagging with lot of loose skin or stretch marks on the breast, then they need a formal surgery of a breast lift. Now, breast lift surgery does not always mean that you need to have a silicone implant done at the time. If a woman is comfortable with the size of the breast and all that she has is sagging in the skin, then we can do a breast lift without a silicone implant, so that the size of the breast will remain the same and it will only give a lifting effect to the breast.
Right. Now, are these cosmetic surgeries irreversible? Because that's a fear. We see so many botched up surgeries, and one wonders if these can be altered. Can these be, or are these permanent?
See, most of the surgeries that we do are done with the aim or intention of being permanent. I mean, if somebody is going for a tummy tuck, they don't want this tummy to come back again. Or if somebody is going for a breast surgery, we want the effect to last. Or for the facelift, we want the effects to last. But that does not mean that we cannot do any form of touch-ups later on, or any kind of revisional surgery. So the longevity is definitely there. But for example, if somebody is not happy with the breast surgery or not happy with the nose surgery, we can always do something to reverse back the treatment, or do something to correct the appearance. So the options are always there.
Right. Is there anything else that you want to add to, in addition to what we've discussed, that has taken your attention, that oh, okay, this is the observation, especially during COVID times? What has been your, and now since it's open, I know your clinic is open for clients, so whoever wants to do anything that you just mentioned, please go ahead and do it, because I have done vampire facial with Dr. Parag, and I think my skin is looking so much better. I have been getting a lot of compliments. I think we are due for the next one, right? So you want to speak
Yeah.
a little bit about the vampire facial, the plasma facial?
Yeah. See, vampire facial, as you mentioned, is something which is quite popular in the Western world, and even in India now the trend is catching on. So our own blood has a lot of regenerative cells. So in a vampire facial, what we do is we take a sample of the blood. It's like a 10 cc sample which is taken, that is processed in a machine which centrifuges the blood, and by spinning the blood or centrifuging the blood, we separate out the platelet rich component of the blood. Now this platelet rich component has lot of regenerative cells. So now we use at our clinic something called as a derma pen. So derma pen is like an electric pen which runs very fast on the skin and creates micro punctures on the skin, and then it helps us in injecting this platelet rich plasma on the skin. So what it does is it completely rejuvenates the skin. So if there is any pigmentation, or if there is any acne issue, or somebody has oiliness on the skin, or early signs of aging like fine lines around the eyes or in the under eye area, it really works wonders. We normally do it as 3 sessions at 1 month interval, and the effect can be expected to last almost for a year. So yeah, it's a good treatment to do.
Right, right. And like I asked you earlier, is there any observations that you've, or experiences that you want to share, since the COVID has kind of, the pandemic has kind of stopped, and not stopped really, but okay, work has started, so we are able to go out and do things. So do you see any change in your practice from pre-COVID times to now, that there is a surge of a certain procedure for some reason?
In terms of procedure, I would say a lot of people now come for immunity boosting drips. So we have some IV drips at our clinic which contain vitamins and other essential amino acids and antioxidants, which help us improve the immunity. At the same time, there is a vitamin called as glutathione, which is also sometimes taken along with vitamin C, and that helps in getting a glowing kind of a skin, or it helps us in get rid of our tan. So these immunity booster drips are something new, and they've seen a lot of surge in the COVID times. And of course, a lot of anti-aging treatments such as use of collagen, which is available in liquid form. So as we age, we tend to lose collagen from our skin. So collagen shots can be taken every morning before breakfast, and this liquid collagen really helps in maintaining freshness to the skin, or it's like an anti-aging treatment.
Yeah.
In terms of invasive procedures, there is something called as nano-fat grafting, which we do quite routinely now. So nano-fat is again similar to what we spoke about, the vampire facial, but instead of blood, we use our own fat, which contains a lot of stem cells. So this nano-fat is really again something which has the inquiries are increasing all the time.
That's fantastic. Thank you so much, Dr. Parag, for responding to all my queries, all my questions with so much patience and in detail. So once again, thank you for having me on your Instagram page and responding to all my queries.
Thank you, Dr. Aditi. In fact, I should be the one thanking you for taking out the time during the festive season to go live with me on our Instagram page. And I hope our viewers have had some good information today about different kinds of procedures, from mommy makeovers to body contouring options. So, friends, thank you for taking out the time to watch us on our Instagram page. And if you have any other queries that you would want me or Dr. Aditi to answer, please feel free to drop in your questions in the comments section, and we will get back to each of you individually. I wish you all season's greetings and a very happy and safe and prosperous New Year 2021 to all of you.
Thank you.
See you, Dr. Aditi. Bye-bye.
See you. Bye. Bye.